are you? Happy Friday. We are here with another Q&A. Again, great questions this week. A lot of good ones. And we'll start on the more kind of a more broad side and broad end of things, and then get a little bit more narrowed down with more specific into hypothyroidism and fertility and all the things. So, at any rate, some really great questions this week. So, thanks so much for all of you guys who are joining. If you do have other questions, please feel free to drop them in. If we do have some time today, I'll try to get to those. But like I said, we've got some great ones again. So, here we go. For those of you who are new to me, my name is Jennifer. I'm a registered dietitian in the Dallas, Texas area, and I have a virtual practice helping women with hypothyroidism who are also struggling to conceive, and couples in that nature as well who are maybe dealing with unexplained infertility, those kinds of struggles, and looking to use food as medicine, to use lifestyle as medicine, kind of things to enhance their fertility, optimize their fertility, and hopefully give birth to the babies of their dreams. So here we are. And let me start with question. We'll just get right into it today. Question number 1 is, what are your thoughts on seed cycling for hormone balance? I've heard pros and cons and wondering what you think. Thanks. Well, you're welcome. Hopefully this will provide some answers, and thank you for submitting that. So, okay, so seed cycling. What is seed cycling? Seed cycling is when for cycling women who are maybe, a lot of people use this for irregular cycles to kind of reignite hormone balance, things like that. You eat certain seeds within your follicular phase and then within your luteal phase. And the follicular phase is from day 1 of the start of your menstruation to the day of ovulation. So if we put that on a 28-day, optimal calendar, which that's not most women, we're either side of that, but let's just, for the sake of 28 days, we'll use that as a guide. So from days 1 through 14, you would be eating a certain amount of pumpkin and flax seeds, and then from day 14 on through roughly day 28 till the day before you start your next menses, you would incorporate sesame and sunflower seeds. And it's about a tablespoon of each of those. So a tablespoon of flax and a tablespoon of pumpkin in the first half of your cycle, a tablespoon of sesame and a tablespoon of sunflower in the second half of your cycle, the luteal phase. So that's what seed cycling is. Now, here's the pros of this in my thought. You're getting some great nutrients. You're getting vitamin E. There's some great what are called lignans in there. Those act as kind of phytoestrogens in our body. It's not like you're eating estrogen. Many people think that when they have these phytoestrogenic foods, it's like consuming estrogen. It's a very different form of estrogen. It binds to different estrogen receptors. And many of these foods can actually be very protective against estrogen and the binding sites where they do bind. They're preventing the more kind of aggressive, active forms of estrogen. So that's what phytoestrogens kind of do. But anyway, these seeds provide that. They provide some great fiber. So that'll help, with irregularity, if you've got that in terms of bowel function. They have great nutrients like selenium, zinc. Both of those are great for fertility in terms of egg quality, in terms of antioxidants kind of things. So those are all great. Those are all the pros of that. Here's some of the cons in terms of seed cycling. It's kind of hard to do, to be honest, for a lot of women that I've talked to who have done it or who have said, can I do this? Sure, these are great foods to include. But if you want to stay on that 1 tablespoon a day or 2 tablespoons, really, 1 of each for each part of that cycle, it's just kind of a lot to keep up with. And here's why: because when I recommend that women do it, or when they ask me about it, I say, if you're going to do it, get the whole seeds and grind them that day. So every day, like in a little mini coffee grinder, put a tablespoon of flax, a tablespoon of pumpkin, and grind those up and use those throughout the day, and try to keep them in the refrigerator even if you do. These fats are very sensitive to oxidation and very sensitive to kind of breakdown or rancidity. So if you grind a bunch at once and then use it all throughout, it just decreases the quality of those fats as you go along. And especially when we're talking about these really highly protective fats that we want the benefit from, when we take those and then we turn them into kind of something that's not beneficial to our body, we're kind of doing an injustice by trying to give it a good thing, but giving it to it in kind of a not so great way. So if we want to get really, specific about it, I really encourage people to grind it every day. If you do grind a bunch at once, the best way to do that is one, keep it in the freezer if you can do that, or the fridge at least. The freezer is going to protect those a little bit more, keep it from, the air and oxidation and things like that in like an airtight container. So that would be a way to do it. If you do grind more at once, try to at least keep it refrigerated or frozen so you preserve the quality as much as possible. What else? In looking at, does this help my cycle? Now, I don't know exactly what this person was wanting it for. She was just saying, for hormone balance, sorry. Can they help balance hormones? Yeah, they can help. It's not going to be, in my experience, from what I've seen, from how I've helped people use these, it's not going to be like, as much as, let's say, a medication or even our natural hormones. They're there to support what we're already doing and what your hormones should already be doing. So if your, intake and lifestyle and everything is just like on point with everything and you want to just kind of fine tune something, this could be really helpful to do that. There is absolutely nothing wrong with incorporating these wonderful seeds every day in your diet. If you're starting from a little bit more, I need to make a lot of changes, and I think some things really need to happen on more of a broad spectrum. Is this one thing, this one element of seed cycling going to be kind of this magic, transformational pill for you? No, I don't think that is the case. It doesn't have that much power, but it certainly is very supportive in the nutrients that they are providing. Like I said, the vitamin E, the selenium, the zinc, the fiber, the phytoestrogens, all of these things, certainly not harmful. So if you're doing it, more power to you. I think it's great. Just keep those seeds fresh. Keep the ground seeds as fresh as possible. If not, if you're not doing it daily, keep them at least refrigerated or in the freezer. And chart, kind of make some notes to see if you've noticed some changes. I think that's the biggest thing that will tell us, is this working? What is it we're trying to change or turn around or reduce or prevent? And as we take notes over time, really being able to see, is this helping in that way? So that's the one thing I would say too is, if you're going to all this work, make sure it's helping. So hope that helps. Okay. Number 2, pain around ovulation, and it's sometimes kind of severe. Is this something to be worried about? Okay, so this person obviously has, dealing with a little bit of discomfort around the time of ovulation and wondering if this is something serious or just that's how it is. Great question. This is a very common experience or sensation for a lot of women as they're ovulating. And there's a funny, I love saying this word because it's just a fun word to say. Mittelschmerz is the kind of term given to this kind of middle phase, really ovulation phase of our cycles as women. And it means kind of like middle pain. When you ovulate, as your follicle is growing all month, it's getting more robust, the egg is forming, the egg is maturing, it's growing, and then you go through this event, right, where the follicle bursts open, it comes out of your ovary, for your fallopian tube to grab it up. And so it's like this little mini trauma, right, to those cells in there. And for some women, it does definitely initiate some extra pain. Some women even see a little bit of spotting or bleeding during that time because the rupture was so strong that it caused a little bit of blood to come, form. So women will see a little bit of that, and sometimes that worries them. Like, am I starting my period? Am I, no, it's probably, again, talk to your doctor. If you see anything that's like, no, this is beyond the norm or what I should see, please talk to your doctor. But some women do see a little bit of spotting around ovulation. This should be nowhere near a flow or anything like that, just a little bit of spotting. So at any rate, the pain comes from that that kind of that burst, literally, that the follicle has of releasing the egg. Now, if women are dealing with additional cysts or things like that on their ovaries, that can intensify this pain. If you're on any kind of medication to stimulate ovulation, like a Clomid or any of those for fertility, this can all be enhanced because this medication is kind of taking your body into overdrive and saying, do this more, do this more, do this more. So everything's going to be enhanced and everything's going to be a little bit kind of over the top in terms of maybe what you might feel for ovulation, because we're really trying to stimulate that process. What else was I going to say about this? Ovulation is really a very finite, we call it a phase, but it's really a finite period of time. It's about 24 to 48 hours that this happens. So if you're experiencing any kind of other pain throughout your cycle, like if there's this constant, pain, or it's more diffuse across your abdomen, or usually an ovarian type an ovulation type pain is very localized. You can almost put your finger on it, and it's either going to be left or right depending upon which ovary is releasing that egg that month. That goes back and forth. That can change. So it's going to be much more localized. If your pain is more diffuse, more spread out across your abdomen, that's definitely not what I would call ovarian or ovulation pain. That could be something else. And if it lasts longer than this kind of 24, 48 hour window, I would definitely say talk with your doctor about that, or if it's just a pain that is beyond what you would consider tolerable, and it's kind of like invading your life, your space, your quality of life. No, I'm not going to tell somebody, oh, that's just normal, deal with it, because that's not what we do. But yeah, definitely talk to your physician or practitioner, whoever you're working with, and see if what you're experiencing is beyond kind of that common symptom of that. But going back to the original question, is this pain kind of normal, quote unquote? Yes, it can be very normal, up to, like I said, any of those outside that boundary, more diffuse across your abdomen, to you just can't tolerate the pain, things like that. Or you're seeing more spotting, more bleeding than you feel like you should at that point in the month. Please, please, please talk to your doctor. Okay, hopefully that helped too. All right, number 3, what to do when I keep cycling through thyroid flare-ups. Okay, so now we're getting a little bit more specific into thyroid. Swollen throat, fatigue, brain fog. And I guess you could say, like, what should I do, or why is this happening when I keep cycling through thyroid flare-ups? Okay, this is a big, big question, a big important question, because you might, if you're looking into this, or what is a thyroid flare-up, some will call these like Hashimoto's flares. Some just call them hypothyroidism flares. They can be very short-lived. They can be, in terms of like a day or 2 days, they can be much more spread out, like over weeks. I've actually been through one of these seasons before, and it's very uncomfortable. It's frightening. So let's talk about what this is, a thyroid flare. So what is it? Basically what it is, and this is going to be different for every single person, so whatever your kind of traditional or normal symptoms are, quote unquote, what I would say for hypothyroidism, it's kind of those taken up a notch. So and some new ones added to that. So let's talk about what those could be. Some people will talk about, and this person even said, swollen throat, fatigue, and brain fog. She said those 3 specific things. So, and that can be exactly swelling in the neck to the point where almost it becomes like a swallowing difficulty, or a swallowing just discomfort. A lot of fatigue. All of a sudden you're just like overwhelmed with this. And I'm not talking just like, oh, I'm sleepy, I need a cup of tea. It's more like I cannot function. And she mentioned the brain fog. You might feel like you're getting sick, like you're coming down with something. To more systemic feelings, you might feel heart palpitations, nervousness, anxiety, like you can't calm down. It may be even more like a panic type feel. Some people will go so far as to seeing hives and rashes. There's a lot of correlation with hypothyroidism, specifically Hashimoto sometimes, and skin irritation, hives and things like that. So sometimes those will flare. Menstrual irregularities can just like all of a sudden go crazy. So those are some of those what I would call, what does the flare look or feel like? That's kind of how I would define that. But again, for you, it could be something different or additional to this. But those are kind of some of what you would read are traditional or common signs that you would see. Now, let's go back to remembering Hashimoto's is an immune problem. It's an immune irregularity, overstimulation of your immune system that happens to attack your thyroid, right? So, Hashimoto's is an immune disorder where your immune system has gone rogue, and instead of attacking viruses and flu bugs and colds and things like that, it attacks yourself, in this case, the thyroid. So, anything that kind of sends that immune system into overdrive, if you already have a diagnosed condition of Hashimoto's where we've seen elevated thyroid antibodies and we've seen that kind of self attack on your thyroid, you will be prone to that immune system going, oh, hey, yeah, we remember, let's go get him. So anything that throws off your immune system can, I'll say, cause or contribute to some of these flare type symptoms going on. That could be a stressful event, right? Maybe something, and as simple as a busy day to as kind of frightening as like a traumatic event or a very sudden happening in your life that just sent you into kind of this stress situation, fight, flight, freeze, kind of thing. Those hormones are there to protect you, but they also kind of change your immune system and send that into a dysregularity. Similarly related, if we've got a lot of adrenal kind of, some will call it adrenal fatigue. I sometimes just call it adrenal dysfunction, where the adrenal glands are constantly in that overdrive, sending out that cortisol. That will change everything from blood sugar to thyroid feedback and all of that. So if we've got this stressful kind of event or dial going up, that can contribute to this. Illness, everything, again, in some people, from the common cold to what's going on in the world right now to anything else in between, that kind of flares your immune system and says, hey, we've got this virus. Those immune modulators can, again, get a little bit confused and head back to the thyroid to possibly do a little bit more damage there, or just kind of stimulate that gland to kind of overproduce and cause some of these symptoms. Chemicals in your food and your environment and our waters, we can't stop breathing, we can't stop drinking, but what we can do is do as much as we can to protect ourselves, especially if we're in the middle of something like this or we know a stressful event's coming, is do all that we can to kind of prepare our bodies for that, to get those things out. Some other things, not eating enough. Sometimes if we go too long without food, again, that thyroid has a feedback mechanism of, oh, she's starving, she's not eating, let's turn everything down, and then we eat again, and then it's like, oh, okay, she's fine, and so it keeps going this kind of extreme back and forth. So sometimes not eating enough or going too long, at least without food, we get kind of that hangry situation, and that can throw things. Again, everybody's symptoms are going to be different, so I'm just kind of throwing out some things that can contribute to igniting that flare. Gut infections. Now, these aren't something you're always going to see, feel, or know that are there. But if we've got a gut imbalance, of too much of the bad, too many viruses, some pathogens, some other things that shouldn't be there, and we've got this kind of constant immune attack on our GI area. It's kind of this constant war that's going on that pulls our immune system away from where it should be acting to this constant battleground. It sends it into this hyperdrive, and it never is able to rest, and so it can cause something like that. Now that I do GI testing and find some things, and I'll be honest, most of the things we find, no, but we didn't. Sometimes I can say, well, I bet you this is going to be in balance, and I bet you it's not, but there's always some surprises. Like I said, you can't see it, you can't feel it. It's not that, oh, you're so dirty and horrible and what you eat. It's our life. It's things we're eating. It's things we're low stomach acid, low, this and that, just causes some of these things to happen. And those are the things we don't always see or feel or know that are going on. Medication imbalances and supplement interactions, these can kind of overstimulate our thyroid sometimes. People are on, certain supplements to, thyroid, let's say adaptogens or extra vitamins, things like that, nutrients, and it's just too much. So it sends a good, if some is good, more is better, like that we always think. But when it comes to thyroid, it is such a sensitive gland. When we dose medications, we're talking micrograms. So it doesn't need a lot, and just a little bit more can sometimes just send it over the edge enough to, again, start that cascade. And So how do you respond to this? What do? Do you just like, oh, let's just, wait it out and get through it? Well, no. In the moment, yes. In the moment, even my personal experience, mine was partly because of a medication. Um, well, it was the wrong medication, the wrong dose, the wrong everything. That's what I said last time. I've been on like every medication there is and finally found my sweet spot. But I would have these, I mean, racing, racing heart palpitations. And it was always in the middle of the night. And they put me on these heart monitors and I went through all this rigmarole. Even had brain scans, like all this stuff. And it ended up just being my medication is not right. I need to change this. But in that moment, just taking time to just breathe, try to tune out as much of the environment as I could and as you can, to just focus on breathing, on telling your body, listen, I know what you're doing right now, you're trying to protect me, but everything's safe, everything's, you kind of send back this message to your body that we're okay, you're just overstimulated by something inside right now, and we're going to get through this. And so doing everything you can to not panic, even though that it feels literally freaky. It feels like, I mean, I thought at times I was having a heart attack or something. I didn't know. And it does, you go into this panic, but just kind of reminding yourself of, okay, this is okay, and breathe through it is, sometimes all of the let's just get through this help that we can do. If it's more of a season for you, definitely talk to your doctor. I mean, if this has been going on cyclically, and maybe it is a medication error. One thing I remind women about, especially, is if they're taking vitamins. This can be very trivial, but it also can be very much of a big deal. Is if you're taking certain nutrients that interact with your thyroid labs, that can cause actually some people to be over or under medicated. So things, especially like biotin. I say if you're on any kind of medication or supplement rather, like a multi, or some people will be on like hair and nail and things like that with like tons of biotin, hundreds of milligrams, thousands of milligrams. And I'll just say, be sure to be off of that for like 3 to 4 at least days before your thyroid labs, to make sure those labs we're seeing are the real labs and not kind of adjusted labs. I can go into that more at another time. But making sure that you're not on medications that are, or supplements that are interacting. Iodine's another big one. If any people are on high dose, anything outside of what's in a multivitamin for iodine, I personally don't recommend it unless you are working with a practitioner that that's their skill, and they're checking your labs so regularly. Iodine can really be one of the kind of pushes the edge on the thyroid. Too much is just not a good thing. So looking at medication interactions, checking with your doctor if this has really been going on for a long time. Some people will notice that certain intake, certain foods set them off. If they've got some food sensitivities, some sensitivity tests, some very specific testing that I do, we'll see kind of some random things that people never experience. That when we get those out, there really is this calm to their immune system. So if you're in a season of this, I would say, maybe make a log of what you're doing to see, diet wise, intake wise, to see, do I notice any patterns? Gosh, every time I have, this for lunch later that afternoon, I'm like off edge, and things like that. So noticing and being aware of maybe what could be playing in. The big ones for a lot of people are, those big guys: gluten, dairy, corn, soy. Those are the big ones that tend to irritate or kind of stimulate a lot of people in terms of immunity and thyroid. So if you're already off of those and you're still noticing things, again, maybe just pay attention to see, is there any correlation? Maybe it's a caffeine thing. Some people are over caffeinated and they don't realize that, and it affects them later. Just little things like that could be playing in. Anything to lower your inflammation, if and I know that's kind of funny to say now, as we're dealing with all of this immunity and keep yourself strong and all of this, but doing what we can to just protect ourselves, and just taking those appropriate measures. Rest when you can. Just try not to overexert yourself, and all those things. Lower exercise if you've been kind of on a maybe exercise kick right now because we've had more time and such like that. Maybe it's too much. Hashimoto's, if it is Hashimoto's, but even hypothyroidism, we do not tolerate that high intensity exercise like the world shows us we should. Orange Theory, and I don't mean to use labels and brands, but anyway, those high intensity things are just really not for us. Our tissue, our muscles, take up thyroid hormone in a very different way. So more of the thing for us is strength training, maybe more not that high intensity, but longer. If we want to go long, just keep it lower down. I think I talked a little bit about last time when in terms of exercise, whatever we're doing, maybe just take it down a notch. If that's not something that's in your, in your lifestyle right now, then that's maybe not playing in. But if it is, that could be something else too. So hopefully that helped as well. So big question there. But yeah, at the end of the day, if it's something that's really never stopping and it's really kind of invading your life and disrupting your life, definitely talk to your doctor for sure. So, okay, next. Do you have general vitamin brand and type recommendations for Hashimoto's patients? Whoa, this is a big one too. Okay, general vitamin brand and type recs for Hashimoto's. So here's what I'm going to say. I can throw out brands all day long, and I can, and I will. What I use for my clients are, I don't like send them to the store and say, oh, go find this one. This will be great for your thyroid. I think that's a little bit hard. And, if you're not living in the same immediate area, I don't know what your store is going to have, or if you're going to have this store. So it takes a little bit of the fear out. So I use a dispensary online where I, it's not my store. It's just like me sending you somewhere, and I fill your cart and I leave it at your little checkout, and I say, okay, here's what I would take. Here's the doses. Here's what times a day, all this stuff. And then you go buy from there. And these are what I do recommend in terms of supplements is third party tested, meaning they will have somebody else, some third party unassociated with them, come and test their supplements to say, hey, are you putting in here what you said the label's on, whatever's on the label, is that what's in the pill? There should be nothing extra. There should be nothing less. It should be what it is. And these are companies that do that. They test for purity. They test for quality, for contaminants, all of these things. So that's what I really recommend. The fillers are, for a lot of people, what end up giving them kind of that doesn't sit well with them. So sometimes supplement companies will use starches, which can be wheat based. Just even if a supplement says gluten free, it can be wheat starch. It's a different thing. So if people are really sensitive to wheat or even celiac, some of those can be very detrimental and cause some of these side effects and symptoms where you're like, I'm just taking a multivitamin. Why is it doing this? Well, it's the fillers, cornstarch, things like that. So that's what I would say. When you're selecting, make sure you're selecting from a manufacturer that is, as reputable as can be, as low and full disclosure on the label that it is what it say it is what I would say. So what specifically, I would say, let's go back to nutrients that support the thyroid. Zinc, selenium, those two help T4, your inactive thyroid, convert to T3. So zinc and selenium are wonderful for your thyroid. Iron, we don't all need iron supplements, but just making sure your iron levels are at a good spot, good levels. Vitamin D, some of those other antioxidants like vitamin E, vitamin C. I actually did a post on Instagram earlier this week about this, nutrients that your thyroid needs. So things like that, making sure. Now, not knowing what your lifestyle, your intake normally looks like, I don't just say, oh, you've got hypothyroidism, so you need to take this supplement. I'm not that kind of practitioner. I look at what you are first, and that's where I do a lot of testing to come in to say, hey, what do you need? If this is not something you're lacking, I'm not going to make you take it and make you remember to take it and make you pay to take it and all these things if your body doesn't really need it. But these are things that sometimes we can get enough of from food. Sometimes we can't. Magnesium is one that I think we all should be supplementing. That's really important for thyroid too. And sometimes it comes down to the forms of these that are in these vitamins that we get. It's not that it's got magnesium, that's great, but maybe it's in a form that's not really absorbable to your body. Same with the B vitamins, the B complex vitamins, B12, folate, B6, those are the big ones for thyroid. And sometimes the vitamins we get, kind of what I would call off the shelf, are just in forms that are a little bit less absorbable, less perfect for our body. And so these ones that I usually recommend people have those forms that are your body's going to know what to do with, and you get this and it goes, right to work. Some other things that can help, if in some people that have been newly diagnosed with something like Hashimoto's or elevated enzymes, elevated antibodies, we'll do something like a short-term systemic enzyme to just kind of break down the inflammation and things like that. Those are short term. For a lot of people who need the gut healing, we'll work on, healing those with some nutrients, as simple as something like bone broth, glycine, the collagen, the gelatin that we get from bone broth, to something like DGL, deglycerinated licorice, to help heal up the tissues, zinc carnosine, so things like that for specific gut healing, maybe some aloe vera. And then again, going back to all those other things in terms of I don't want to say go find this brand, because to be honest, in a lot of the stores, some of the brands I use and recommend, you're not going to find out there. Like a great one for fish oil that you will find, which I love, is Nordic Naturals. So again, I think it comes down more to the form of the vitamins, what does your body actually need, and are there any other excipient ingredients, fillers, things like that we don't want to see, that your body doesn't really want or need. So that's kind of what I would say in terms of that. And then for a prenatal, I will throw out my favorite brand, Full Circle Prenatal. That's one you'll get online as well. It's actually from one of my colleagues, another RD, Ayla Barmer, and she developed this. It's literally like the best prenatal out there, and that is one I would recommend in that regard. So I hope that was helpful. Again, I work really individually with my clients when it comes to supplements, because I don't like to just be this supplement dump truck that comes and says, like, here, take all these and don't ever eat again because you're just taking pills. Like, it's a little overwhelming. So I'm really specific with that, and knowing where are you in your hypothyroidism kind of spectrum and in your journey. Is this newly diagnosed? Is this just maintenance, and things like that? So, okay. All right. All right, now we're getting into a little bit of a medication question, a thyroid medication with pregnancy. So I'm going to throw out a little disclaimer after I read this question, but for the lack of a better, we'll get it answered. How often during pregnancy should my doctor check my thyroid labs? She just increased my thyroid medication and I'm 8 weeks pregnant. She said to check them again in 3 months. This seems kind of far out to me. So, 1, I'm not your doctor. 2, I'm not your dietitian. So I'll give kind of a very blanket recommendation on this one. I'm not going to say your doctor is doing this wrong. I'm not going to say, anything like that. I'll just say what I would, if I were a patient in this situation, what I, as a thyroid patient and mom to be, would hope my doctor would do for me. So usually in pregnancy, especially if you have a diagnosed thyroid condition, your labs are going to be checked about every 4 weeks, especially during the first half of your pregnancy, the first, even beyond the first trimester. But so I say, roughly 20 to maybe even 24, 25 weeks, because your thyroid, mom, is taking over for you and for baby. Baby does not have a fully developed thyroid until later on in his development and her development. So we're kind of not doubling up, but probably time and a third or so for him or her in us as well. So especially if we're on medications, a lot of doctors will have you check labs about every 4 weeks to just see, are we staying where we need to be? Is that TSH staying down? Our T, and hopefully it's more than TSH, but T4 or T3, are those staying where they need to be? Is the medication getting into our cells and working and having that good feedback mechanism? And again, about every 4 weeks. 3 months, yeah, that's definitely a little bit longer. I don't know if this is someone who is specialized in that endocrine kind of spectrum of health. If this is just kind of a general OB-GYN and yeah, we did a TSH and it was high and here's some thyroid medication and we'll check it later. I don't know. So again, if you're not comfortable with what your doctor has recommended, I would just say, please, you're the patient. as much as you can. I know this is easier said than done, but advocate for yourself and just say, hey, I want these labs done more frequently. If they don't, just ask them to record that, hey, I asked for these and the labs were denied right now. And that's, your prerogative to have that written in the chart as well. Because as a patient, what we're asked for, if it's not declined, if it's declined, we want to make sure that we know that they know we asked and it's on record, that we did not have that request fulfilled. So that's one thing I would say. I would say, talk with your labs or your doctor about taking your meds and when you get your labs drawn, because some doctors, if they're and going back to even some of the supplements, if you're on other supplements that are throwing labs, and I don't know how you're feeling right now, but if you notice any other symptoms that you're not feeling well or you're feeling different, at that point I would definitely step in to say, hey, we not can we, don't end it with a question mark, end it with a period and say, when can we, I would like to have these labs drawn, let's please do them. And so that's one thing I would say with that. So again, not telling you your doctor's doing anything wrong. 3 months is a little bit longer than most would like to wait to check that. And so I would just say, have that conversation, and hopefully you'll get a nice response and kind of feel at peace with what your doctor says, and they don't kind of pull you through that ringer of, discord and all of that. So, okay, here's another medication question. I'll answer this as much as I am able. It's a little bit longer question, so let me set it up. I've been trying to conceive for 7 months. I found out last week that I have hypothyroidism and was put on 25 micrograms of levothyroxine. That's T4. I feel much better already, but I also started spotting very lightly yesterday. I'm not, let's wait. Okay, last week, so barely a week. I feel much better already, but I also started spotting very lightly yesterday. I am not supposed to start my period for a week. My doctor wants me to get more blood drawn on day 3 of my period, but now I don't know if this is the real start of my period or not. Is it common for levothyroxine to cause changes in your period like this? Okay, so summarize that up. She's been trying to conceive for 7 months. She started on levothyroxine a week ago for newly diagnosed hypothyroidism. She started seeing a little bit of spotting. She doesn't know if this is the first day of her period or if this is just like spotting, mid-range. And is this common? Okay, let me set this up again, just kind of setting the facts. 1, kudos to your doctor for checking day 3 labs. Hopefully those day 3 labs are follicle stimulating hormone, luteinizing hormone, and estradiol. Those are usually the ones that are done on day 3. Now they may add in like an anti-malarian hormone. They might add in some other things that are a little bit less sensitive as where in your cycle you're getting these labs drawn. But usually on those day 3, we're looking at those 3 main ones: follicle stimulating, luteinizing, and estradiol. Maybe prolactin too, if they want to throw that one in. So great for that. What I would ask would be, what were your cycles or your periods like before starting levothyroxine? Were you this perfect 28-day girl? Were you not ovulating at all, so we were not having regular periods, or we'd go from 28 to 45 to 30 to I don't know what her cycles were like before, so I don't know what we're coming from. And for me, that's a really important question to know, to answer the why. Why is this doing this? Well, because here, okay, that makes sense. So I don't know that backstory. The short answer to this is yes, levothyroxine can cause changes in your period, because if we go back to what is our thyroid's job, it's to tell our body that we're safe, that we are secure, that we're good for reproduction, that we can allow these hormones to go. And when there's that disconnect, when we have a thyroid problem and it's not working, it tells those reproductive hormones, hey, I can't keep up with her life, so please do not allow another life to be born. So estrogen, progesterone, luteinizing hormone, follicles, like, y'all just take a break, turn off. So we don't see ovulation, we don't see, this normal cycle happening, and there's this disconnect. So starting a thyroid medication can kind of reignite that communication for your thyroid to say, hey guys, hey reproductive system, we're good, we're back, I'm safe. I can do this now. I have help. And so we've kind of reignited that communication. Um, could that cause some spotting? Yes. Again, I don't know where in your cycle you were when you started this. Was this 4 days before your period was starting, or was this, the day after you finish menstruation? I don't know. So at any rate, it can reignite that communication and maybe cause a little bit of like excitement, right? And some of that excitement could be a little bit of spotting, could be a little bit of shedding if we've had, maybe estrogen did something and allowed a little bit of that lining to shed and whatnot. I don't know. Could it be an ovulation? Going back to what we said at the beginning, could it be a little bit of spotting seen from ovulation, that this hormone encouraged ovulation, and we've never had that in a while, so we had a little bit of that kind of trauma to the ovary caused spotting. Could be that. Um, you know, so again, this is not my question to answer. I just want to tell you what could be causing this. I want you to talk to your doctor. Again, I'm not that person. But to answer the question, is it common for levo to cause changes in your period? Absolutely. And hopefully that will be from a not quite as regular or regulated sense to a more regulated, positive flow cycle, all of that. Hopefully we're moving in that positive direction with your cycle. With thyroid medication, it takes anywhere from about 4 to 6 to sometimes even 8 weeks for it to really take effect. T4, which is levo, has what we call a very long half-life. So it takes it a while for it to really get into your system and do its thing. And that's why most doctors won't check it, again, for about at least, you start it and then they're like, okay, let's check it again in your 6 weeks. You're like, 6 weeks? Why can't we check it tomorrow? It takes a lot longer than that to work. So give it some time for your body to regulate. I would say at this point too, start charting your cycles. If you're not, that is like the biggest free gift you can give to yourself to begin to evaluate how your body is functioning with your basal temperature, your basal body temperature in the morning, first thing in the morning before you get out of bed. That will confirm ovulation. We see that temperature spike. We could have a whole discussion on charting, but you'll see that temperature spike after ovulation has occurred. Looking at your cervical mucus, that will show you when you're ovulating. It kind of leads up to ovulation. You'll kind of peak right around ovulation, and then it will kind of taper off. So you've got about 5 to 6 days maybe of kind of cervical mucus show. That's a really good indicator of ovulation. And then also if you're really adventurous, checking cervical position, that can be another third indicator of that kind of triad of temperature, mucus, and position of your ovulation and fertility kind of window. So I would definitely say using those three, if you're not charting already, to kind of coincide that with now that you're on the medication, to see what changes you do notice. If you haven't been charting before, it'll just kind of make you more aware to what is going on. If you have been charting, maybe you'll begin to see some changes or some kind of leveling out of things or something like that. So hopefully that was helpful. Okay, y'all, that was it today. So again, great questions. I will put these back in the comments so you have these to refer back to. If this was helpful, again, like always, just like it or give me a comment or send me a private message, DM, let me know. I'm always here to hopefully help, give you some answers, shed some light on some things, provide whatever knowledge that I can for you in your journey, whether it's specifically about something you're experiencing or something you've heard, or however broad, general, or specific it can be. I'll always try to answer to the best of my ability. And when I can't, especially like a doctor-related question, I'll give you kind of that general, overview and then send you back to him or her to just kind of fine-tune it. So have a wonderful Friday. Have a wonderful weekend ahead. Stay healthy, stay well. As always, just let me know in the comments any other questions you have, and I'll be sure to try to answer those next time. All right, everyone, have a great afternoon. Bye. Thanks for tuning in.